Hello everyone. So today I'm going to discuss how to take a history in the psychiatry station. So just like every other station, the first part here is the presenting complaint, which is P1. Okay. So the psychiatric symptoms can be like the patient can tell you the doctor, I have a low mood, or doctor, I feel like I'm going mad. Okay. So you cannot do Socrates or Odipara here. All right. So you will just ask the patient to elaborate. So you will tell the patient, I'm so sorry that you are going through this. Can you please tell me a bit more about it? Okay. And let the patient tell you in a minute or two what the patient is feeling. So this is your first golden minute. All right. And the next thing you will ask about precipitating event, because psychiatric symptoms, they tend to be like a story. There must be some story related to it. So you should ask about the events leading to the to this symptom, to the current condition. Okay, and any triggers that might worsen or brings on the condition. Okay, and what is the impact of these symptoms on the patient's life in general, on the patient's work, on sleep, appetite, relationship, etc. Okay, and any other associated symptoms. So, for example, a depression patient can present with low mood, but then you need to ask about other cardinal symptoms of depression, like lack of appetite, feeling insomnia or hypersomnia, feeling bouts of crying, lack of interest in hobbies. So the associated symptoms of the psychiatric illness. All right. And then some questions to rule out the differential diagnosis. Okay. So a pro tip for psychiatry is to always use normalizing sentences. Okay, so for example, if a patient present with depression, feeling of low mood, or feeling of worthlessness, so how to ask about self-harm in this patient? So try to normalize the sentence. So tell the patient that whenever people feel low, sometimes they try to harm themselves. Uh, have such thought ever crossed your mind? Okay. Or for example, a patient of anorexia nervosa, and you want to ask about the use of diuretics or the use of pills for weight loss. So, to ask about the methods of weight loss. So this is also a bit of a difficult question. So a better way to ask could be, some people try to use water pills for losing weight. Can you please tell me what are you using for losing weight? Okay, so try to normalize the sentence. Okay, it makes the situation a little bit less difficult for you, and the patient will open up more easily. Okay, then in other stations we only have past medical history, but here we have past psychiatric history and past medical history. So in past psychiatric history, we will ask about previous episodes of the similar symptom or previous episode of any psychiatric illness. Was there any hospital admission? If yes, the length of stay, what was the treatment given, and the follow-up plan, and are they following up regularly? Are they compliant with their medications? Okay. All right, then the past medical history. So any medical condition, especially the endocrine problems, for example, the thyroid problems can cause psychiatric symptoms, like hypothyroidism can cause depression, and hyperthyroidism can cause symptoms like generalized anxiety disorder. Also, any long-term medical condition, any chronic medical condition can predispose to the risk of depression. Okay. Then, in other stations, after the past medical history, we have Meftosa, but here we have Femish. Okay, Femish is replacing the Meftosa and Kefedex. Okay, the lifestyle question and Meftosa are replaced by Femish here. So Femish is a mnemonic, and here the first F is basically, it is F3. Okay, so there are three things that start with F. First one is family. So we'll ask about any family history of psychiatric illnesses, and who do you live with, and any supportive friends or family. It's really important to ask about the role of the family. Does the patient perceive the family as supportive or not? Does he have any close friends or not? Is there anyone at all that he can open up to? Okay. So please must ask about family, and keep this in your mind in all psychiatric station, because you must check the patient support system to see how vulnerable the patient is. The next is finances. This is basically asking, do you work? What do you do for a living? Okay. And then the forensics. So have you ever been in trouble with the law? So F3 stands for family, finances, and forensic. And then A stands for alcohol. The A in famish stands for alcohol. But along with alcohol, you should ask about other drugs also. Okay, any recreational drugs, etc. Then medications. So the M in famish stands for medication. So you should ask the patient if he's on any regular medications, because some medications can also cause psychiatric symptoms as side effect. For example, steroids can cause symptoms like depression. Then insight, this is a very important question that you need to ask in all the psychiatric station. And this is, do you think you need some medical help with the problem that you are experiencing? Or do you think that you need some medical help with whatever you are experiencing? So this will let you know that whether the patient knows that he is experiencing a problem or not. So this is basically the insight. Checking the insight is really important. And then sleep. So what is the impact of this condition or your sleep? And the last one, H in famous stand for hallucination. To ask about hallucination, you should ask, do you ever feel like you can see and hear things that other people can't? Okay. So insight is the must, like it's the absolute must in all the psychiatric station. But for example, if you don't ask hallucination and anorexia nervosa, then it won't cause any problem. But asking insight is important in all the stations. Like, and similarly, you cannot miss hallucination and, for example, the schizophrenia patient. So keep the famish in mind. It is not necessary that you should follow the same FAMISH like in that order, but to roughly give you an idea. Okay, so that was all. No, I think one point is remaining, and that is basically the ideas, concerns, and expectations, which are also a part of data gathering. So people tend to forget about the eyes in the psychiatric station. For example, if a patient presents with if a suicidal patient presents after committing suicide, and you are taking the psychiatric history, people either forget or they shy away from asking the ideas, concerns, and expectation. Please remember that you still need to ask. Like from psychiatric patient, you will still ask that is there anything that you are concerned about in the moment, and what were you hoping for you to happen to you tonight, okay, or today? So and any expectations from the team at the moment. So you should still ask the ideas, concerns, and expectations, and you should still address them in the management part. Otherwise, you cannot score more than 2 in the data gathering and more than 2 in the management if you forget about ideas, concerns, and expectation. Yeah, so that was all about the psychiatric history taking, and it will be more clear to you when we discuss the different symptoms in psychiatry, how to take the history and management one by one. Okay, so best of luck with your preparation, and I will see you soon with another video.